Okay, we're continuing with the book here, The Hidden History of Health and Nutrition by me, Pete Rogers. We're talking about the Western abdomen as well as abdominal pressure syndrome. So Dr. Dennis Burkitt came up with the term abdominal pressure syndrome. I came up with the term Western abdomen. They go together. You know, one of the things I do is I'm a diagnostic radiologist and an interventional radiologist, imaging guided surgeon. I've seen, tens of thousands of abdomens. Okay, and so with Dennis Burkitt, I'll show you the picture because it'll be easier to talk about it once we're looking at the picture, and it'll combine both of these things into it. So let me go to the drawing. Okay, here's a drawing of an abdomen. There's four quadrants, right and left upper quadrants, right and left lower quadrants. When you eat high fiber, which comes from plant-based diet, there's only fiber in plant food. There's no fiber in animal foods, and there's very little in processed food. The fiber attracts water to the stool, and that softens it. So when you defecate, it's like a cow patty instead of being like goat pellets. When it's like a cow patty, you come home after work, you're in a safe environment, your butt knows when you're home and it's time to take a dump, and you just sit on the loo, and it's just a reflex. Whoop, comes right out. There's a reflex contraction due to stretching of the rectum by the large, soft stool. In comparison, if you have a dried out stool due to the lack of dietary fiber, somebody who eats a lot of animal foods and processed foods, then you have to strain your abdominal muscles to defecate. That's called a Valsalva maneuver, and that generates increased intra-abdominal pressure. And so you have increased intra-abdominal pressure. It pushes your stomach up into the chest. It's constantly beating against the diaphragmatic hiatus opening for the esophagus to connect to the stomach, and that opening gets a little bigger and part of the stomach pops into the chest. That's called a hiatal hernia, HH. And then that causes loosening of the LES, lower esophageal sphincter. You get gastroesophageal reflux disease, GERD. That often causes chronic inflammation of the esophagus called Barrett's esophagus, esophagitis, and that increases your risk of esophageal cancer. Esophageal cancer, I see a lot of cases of esophageal cancer, okay? And it used to be smoker-drinker cancer, squamous cell cancer. Now it's more often an adenocarcinoma from gastroesophageal reflux. Okay, and very often you'll see what I call hot disease, cold disease. This is a very useful term I'm going to tell you. Trust me, it's super useful. Hot disease means acute inflammation. But if that inflammation becomes chronic, it'll sometimes then transform into fibrosis. The fibrosis, laying down a collagen in the tissue, will isolate some of the tissue from oxygen delivery, and it'll become ischemic, meaning deprived of oxygen, hypoxic. And when that happens, the cell will sometimes revert to a primitive life form, if you will. It's almost like changing to an anaerobic bacteria. The cell, normally aerobic, will become anaerobic, and it'll sometimes lose its growth control, grow out of control, and become cancer. That's what cancer is, the loss of growth control. So hot disease, cold disease, fibrosis, ischemia, hypoxia, cancer. So that's why you don't want chronic ischemia, because it increases the risk of cancer in those locations. All right, the downward pressure of lack of fiber causes hemorrhoids in the rectum, causes varicocele in the scrotum, dilated vein in the scrotum, causes down pressure into the leg, and that's varicose veins. Okay, so you don't want this. Causes back pressure into the sigmoid colon, and then you get these bulges in the wall of the sigmoid colon called diverticulosis. If one of them pops, that's diverticulitis. You spill stool into the abdomen, causes intense inflammation, intense pain. I've done over 100 abscess drainages of diverticulitis-related abscesses. Okay, you cause increased tendency to outpouching, to push bowel through a weakness in the fascial layer, and you get inguinal hernia, for example. The dried out stool in the appendix can form an appendicolith. So like here's your appendix, and you form a stone up here. It'll obstruct the lumen. The mucus secreting glands beneath it keep secreting their mucus. It can't get past that stone. The appendix pops. That's appendicitis. You're spilling stool into the abdomen. Okay. With these lousy diets, you have an increased tendency to get Helicobacter pylori and get gastric ulcers. Okay. And so that was basically Dennis Burkitt's abdominal pressure syndrome. And you have increased incidence of colon cancer. In parts, you got more secondary bile acids in your colon. That's one of the other reasons. The lack of dietary fiber, you get more apoptosis of colonic cells, enterocytes, gut lining cells. All right, so now what are some of the things that I would call Western abdomen? The Western abdomen is that you also will, in these same patients, the high-fat diets increase the risk of gallstones. 95% of gallstones are cholesterol gallstones, so these patients will tend to often have gallstones. You're also going to, I'll show it on the next picture, I'll show more of these things that are new. We covered most of what's on that picture. These patients, you know, the vast majority of them have coronary artery calcifications from coronary artery atherosclerosis. Same patients, because they're eating a high-fat diet, so they get everything. An animal food, processed food diet tends to be high in fat, high in simple sugars, low in fiber, low in magnesium, low in potassium, low in, you know, nitrate, precursors of nitric oxide. They tend to be hypertensive and diabetic. They get abdominal aortic aneurysms. They get a lot of kidney stones. They get osteoporosis combined with ischemic degeneration of the spine. This is the Peter Rogers, MD, ischemic and biochemical theory of spinal degeneration. Due to the lack of blood flow to the spine, you get degenerative disc disease. Then you start forming bone spurs to fuse all the vertebrae because you get segmental instability due to the disc failure. Okay, so you get a degenerative scoliosis. This degenerative scoliosis happens because you'll have ischemia on one side of the vertebral body more than the other, and then that part of the disc will fail more on that half. So then it degenerates and it becomes scoliotic. What else? You get a fatty liver. Fatty liver is like diabetes of the liver. And if they don't turn that around pretty fast, then you end up getting a fatty pancreas, which is diabetes. And the more fatty atrophy you get replacement of that pancreas, it means the more loss of beta cells, the more likely the patient will then become insulin dependent. Because type 2 diabetes, if you reverse it quickly and switch to a low-fat plant-based diet, you'll cure it 100%. But if you don't get going fast, you're going to gradually keep losing more pancreatic beta cells. The pancreas gets replaced by fatty atrophy. Ask any radiologist to see tons. They see this all day long, every day. Kidney stones, at least kidney calcifications, AAAs, abdominal aortic aneurysms, degenerated scoliosis spines, degenerative disc disease, fatty liver, gallstones. This stuff is so common. It's like a radiologist says all that stuff in their sleep. They don't even think about it. Coronary artery calcifications, that'd be like a typical CAT scan report. Incidentally noted is a left kidney lower pole non-obstructive stone, 7 millimeters, period in the paragraph. There was diffuse fatty liver, hepatic steatosis, period in the paragraph. There was a small infrarenal abdominal aortic aneurysm, approximately 3.3 centimeters in diameter, period in the paragraph. It's just normal for these patients to have 10 different diseases. That is the Western abdomen. Oh, and I noted that, look at all these Irish doctors. Dennis Burkitt was an Irish doctor. John McDougall is an Irish doctor, and I'm half Irish doctor. Okay, yay, the Irish did something. Okay, here's showing an ischemic capillary. I don't know if we want to get into that right now. Oh, the hypoxia. Oh, we're going to talk about the brain next. So that'll be it for today, talking about the Western abdomen. I hope you found that helpful.